and welcome to the Megacast. I'm Tyler Keefe in the studios of our flagship stations, Civic Center TV and 89.3 Lakes FM. In addition today, as always, we're on Birmingham Area Municipal Access. Our cable television stations, our public cable TV stations in the Oakland County area, are on Comcast Channel 15 and AT&T Channel 99. You can also find us on the radio on 88.1 WBFH in Bloomfield Hills and right here in the greater West Bloomfield area where we broadcast out of on 89.3 Lakes FM. We're also on the internet, civiccentertv.com. Click on our Watch Live link or view us in the small player at the top right of our homepage. We're also online with My Michigan TV. You can find My Michigan TV on your app store, on your mobile phone, as well as on your smart TV, Roku TV, Fire TV, Apple TV, wherever you get your smart TV content from. You can find My Michigan TV by just searching My Michigan TV, or find it online and subscribe for free at mymytv.com. That is MYMITV.com. My Michigan is Michigan's free streaming service with content from all across the Great Lakes state from creators all across our state here in Michigan. And you can also find us on Facebook, facebook.com/CivicCenterTV15 and facebook.com/LakesFM. And if you miss any of our episodes, any of our interviews, or you want to go back and listen to some of the more important interviews or interesting interviews that you find interesting, you can go to our website, civiccentertv.com/megacast. There you'll also find more information on our partnering stations. So if you want to learn more about what Birmingham Area Municipal Access does outside of their playing of our program from 10 a.m. to 12 noon live, you can find that on our website. Click on the link that goes directly to their informational page and learn more about what they do over at Birmingham Area Municipal Access. Same thing with 88.1 WBFH The Biff. Find all their student programming that they run throughout the school year, which will be beginning very soon, and they have some great young student broadcasters that are doing everything from news broadcasts, kind of similar to what we're doing here with the Megacast, sports radio broadcasts, sports talk. They also do the Bloomfield Hills Blackhawks football games as well on 88.1 The Biff. And you can learn more about all of that by going to our website at civiccentertv.com/megacast. And on civiccentertv.com/coronavirus, you'll find each and every day's top headlines as well as important links from the Centers for Disease Control, the state of Michigan, Oakland County, and many of our local municipalities, so that you don't have to dig through the weeds of the internet and find all that misinformation and determine what is false and what is truthful, what experts in the front lines of this pandemic have actually done research on versus what Sue Ellen in her basement has decided to type up angrily in the middle of the night. You don't have to find that difference. We have that difference for you. We send you directly to the CDC, directly to the Michigan Department of Health and Human Services, directly to the Oakland County Health Division, and to immediate pages about COVID-19 from many municipalities in the Oakland County area. That is on civiccentertv.com, as well as our top headlines for each and every day, except for today, as our website has been a little bit of a pain this morning staying connected, so I could post these articles for you. It's been about as productive and cooperative as a Karen arguing against masks with experts who have been researching this their entire careers and have spent decades in the field. It's about as useful as that today. So we'll try to get those headlines posted on our website at civiccentertv.com later on today, and our apologies to those looking for those right now to follow along with our broadcast, and also apologies to the Karens for me calling you out in comparison. But nonetheless, we still have many top stories today, and we'll start off. Michigan COVID cases are up amongst vaccinated people, but those vaccinated people are less likely to be hospitalized or die as a result. This is from Bridge, Michigan Magazine. As Delta variant spreads, Michigan continues to see a rising number of breakthrough cases, or cases amongst those that are vaccinated, with a quarter of the most recent new infections hitting those who are fully vaccinated. In the latest state report, nearly 2,500 breakthrough cases were reported in Michigan for the week ending in August 17th, up from 1,900 in the previous week before. The number of infections among the fully vaccinated has doubled in the past 4 weeks, mirroring the jump in overall new cases spurred by the more virulent Delta variant of the coronavirus. But public health officials say those infections do not mean the vaccines are not working. They note that the infection rate remains far lower among people who are already fully vaccinated and that very few people end up in the hospital or dying. Quote, I always remind people the vaccine, wasn't to prevent sniffles, said Dr. Mark Hamid, a medical officer for 8 Michigan counties in the Thumb and Northeast Michigan, who told Bridge Michigan Magazine this on Thursday. For the more ardent opponents of vaccines, breakthrough cases offer quote-unquote proof that vaccinations aren't necessary. Hamid said, the anti-vaxxers love that. It's a breakthrough case. It doesn't work, in close quote. But Hamid, who is also the chair of the Michigan Academy of Family Physicians, said that's absolutely incorrect. And he's a doctor, so he actually knows that. Hamid said some of the vaccinated were always going to get infected, but the vaccines have helped prevent more serious illness, hospitalizations, and deaths. Statistics underscore the point. What a concept, according to state and federal data. Among some of those statistics, and statistics are, of course, studies that have been done, collections of data that have been used to analyze information for those of you that like to pick and grasp at straws for misinformation and spread it conveniently. From the beginning of the year through August 17th, roughly 57,000 people entered Michigan hospitals with confirmed or suspected cases of COVID. Data from the Centers for Disease Control and Prevention shows. The most recent report says of those, 779 were fully vaccinated. That's a pretty small number in comparison to the wider range of those who have been hospitalized in Michigan with COVID cases from the beginning of the year through August 17th. Over the same period, 7,121 deaths have been tied to COVID-19, with 267 people among those being fully vaccinated, according to the state. Of the deaths, 88% of those deaths, 88% were people 65 and older who have been identified from the onset as being more vulnerable to COVID-19. The most recent infection rate for the vaccinated stands at 8 cases per 100,000 daily, according to Bridge's analysis of the state data. The rate for the unvaccinated is more than double at 17 cases per 100,000 people daily. As of this week, 4.6 million people in Michigan, or 55.3%, of residents 12 and older have been fully vaccinated. The protections against serious illness from the coronavirus may be better for vaccinated individuals than even the numbers suggested. A West Michigan health system this week reported that some COVID patients who had been vaccinated were hospitalized for other reasons, injuries from car accidents, for example, but were found to be infected with COVID as a matter of routine hospital testing and are now listed among the breakthrough cases and hospitalizations. In a quote from Dr. Liam Sullivan, adult infectious disease physician at Grand Rapids-based Spectrum Health, he said, quote, they probably got exposed and got infected, but they're not showing any symptoms because their immune system has the infection already under control. The shifts in data recently with the rise in breakthrough cases underscore the evolving imperfections of science and mutability of a virus that has claimed more than 20,000 lives in Michigan alone. For the vaccinated, public health officials say the increase in breakthrough cases and the rise of the Delta variant shouldn't be ignored. Dr. Hamid said he would recommend everyone, including the vaccinated, return to wearing masks when indoors away from their home. The vaccinated, quote, let their guard down because we told them to, in close quote, said Dr. Hamid, referring to the CDC's pronouncement in May that vaccinated people could drop the wearing of masks indoors. In late July, the agency then reversed that advice. Dr. Hamid continued, we have to go back to mitigation measures we know worked before the vaccine, in closed quote. So yes, we're seeing more breakthrough cases. The Delta variant is taking its toll, but among those breakthrough cases, a number of those breakthrough cases are just really circumstantial. They're caught because people are going into these hospitals for other reasons. They're going through the normal COVID-19 protocols to keep themselves and to keep other patients and the staff at these hospitals and doctors and nurses and so on healthy and prevent the spread of COVID-19 in those health facilities, but they happen to test positive but not be showing any symptoms. The whole point of these vaccines, and this was said from the very beginning when they were first going through the initial testing of these vaccines, it was not to be preventing cases of COVID-19. It wasn't going to do that. It was simply going to prevent severe symptoms, hospitalization, and reduce the chances of somebody that was hospitalized dying from COVID-19. It's doing just that. So those arguments that are out of favor of this are maybe not fully being considered because of that. In Wayne County, officials are expected to issue COVID-19 guidance to schools today. This from the Detroit News. Wayne County health officials are expected to issue COVID-19 guidance to schools on Friday. Quote, the health and safety of students in Wayne County is our top priority as we welcome them back to school this year, said Davida Colbert, superintendent of the Wayne Regional Educational Services Agency, or RESA, in a statement. RESA, which provides services and support to the more than 30 districts in the county, has been in ongoing conversations with the county health division throughout the pandemic about safety mitigation measures, she said. Colbert said the health department was expected to offer additional direction on mitigation measures and safety procedures on Friday. Quote, the work of our educators across the county in preparation for the school year has been extraordinary, especially given the ongoing challenges presented by the pandemic, she said. I know they are all eager to welcome students back to school in a safe and secure learning environment that protects the health and well-being of their students, and close quote. The county has not formally decided on a mask policy as of Thursday night, but Tiffany Jackson, a spokeswoman for the Wayne County Executive, Warren Evans, said Wednesday that, quote, we are in discussion with school districts and communities and heavily considering the implementation of a mask mandate for in-person learning, and closed quote. On Thursday night, she told the Detroit News in an email that county officials would, quote, have something solidified tomorrow, and closed quote. Tomorrow is today, of course. Friday, as that was last night. Others were weighing in, meanwhile, to urge the county to issue a mask order, most of them being Democratic members of the government who had written to the health department in Wayne County urging masks as well as other situations. So that is something that we can expect to hear today. Of course, Oakland County earlier on in the week had issued its own mask order for students, staff, and faculty in school facilities that would be implemented immediately as we head into the school year, and that was a reaction to previous information where they had not put that out. And of course, Governor Gretchen Whitmer and her administration said they would not put individual mask mandates out over the state, but would instead leave that up to county health departments and school districts themselves to make that decision. Some unfortunate news about evictions and the housing crisis in the U.S. and of course here in the state of Michigan as well, as the U.S. Supreme Court is allowing evictions to resume during the pandemic. This from the Associated Press. The Supreme Court's conservative majority is allowing evictions to resume across the United States, blocking the Biden administration from enforcing a temporary ban that was put in place because of the coronavirus pandemic. The court's action ends the protections for roughly 3.5 million people in the U.S. who said they faced eviction in the next 2 months, according to the Census Bureau data from early August. The court said Thursday in an unsigned opinion that the Centers for Disease Control and Prevention, which reimposed the moratoriums on August 3rd, lacked the authority to do so under federal law without explicit congressional authorization. The justices rejected the administration's arguments in support of the CDC's authority. Quote, if a federally imposed eviction moratorium is to continue, Congress must specifically authorize that action, and close quote. That is from the Supreme Court. That's what they wrote in their statement. The three liberal justices dissented. Justice Stephen Breyer, writing for the three, pointed to the increase in COVID-19 caused by the Delta variant as one of the reasons the court should have left the moratorium in place. Quote, the public interest strongly favors respecting the CDC's judgment at this moment when over 90% of counties are experiencing high transmission rates, and close quote, said Breyer. The White House press secretary said the administration was disappointed by the decision, and President Biden, quote, is once again calling on all entities that can prevent evictions from cities to states to local courts, landlords, cabinet agencies, and so on to urgently act against to prevent evictions, and closed quote. Democratic Representative Cory Bush from Missouri, who had camped outside the Capitol as the eviction moratorium expired at the end of last month, said Congress must act to reinstate the protections. On evictions, President Biden acknowledged the legal headwinds that the new moratorium would likely encounter, but Biden said even with doubts about what courts would do, it was worth a try because it would buy at least a few weeks of time for the distribution of more of the $46.5 billion in rental assistance that was approved by Congress. quote, school districts and larger, so that was approved by Congress. Continuing on with the rest of this article, the Treasury Department said Wednesday that the pace of distribution has increased and nearly 1 million households have been helped, but only 11% of the money, just over $5 billion, has been distributed by state and local governments, according to the Treasury Department. The administration has called on state and local officials to move more aggressively in distributing rental assistance funds and urged state and local courts to issue their own moratoriums to, quote, discourage eviction filings, and closed quote, until landlords and tenants have sought the funds. A handful of states, including California, Maryland, and New Jersey, have put in place their own temporary bans on evictions. In a separate order earlier this month, the High Court ended some protections for New York residents who had fallen behind on their rent due to the pandemic. The High Court hinted strongly in late June that it would take this path if asked again to intervene on the moratorium. At that time, the court allowed an earlier pause on evictions to continue through the end of July, but 4 justices, conservative justices, would have set the moratorium aside then, and a 5th, Justice Brett Kavanaugh, said Congress would have to expressly authorize a new pause on evictions. Neither House of Congress has passed on a new eviction moratorium. So this is definitely going to be a hot topic on Capitol Hill, I would expect, going forward, as this eviction moratorium has now since expired, which is going to, of course, cause some major issues for a lot of people across the country. As I said in this article, about 11% of that federal money that's supposed to go toward rental assistance, both for tenants and for landlords across the U.S., has been distributed. 11% of that money has been distributed, of $46.5 billion that's set by Congress to help these people who are struggling with paying their rent and their mortgage out. So this is going to continue to be a struggle for them while Congress gets its act together, and while hopefully the Supreme Court and other powers that be sort this out, because real people are being affected by these eviction moratoriums. We're going to have a lot of people kicked out of their homes. And yes, sure, landlords are also struggling through this in many cases too, because they haven't been able to collect that rent. But this rental assistance is what the whole purpose of this rental assistance is, to help that dichotomy out, to make sure that renters are able to pay their rent so that landlords can pay their mortgage. And so we don't have a bunch of people that, on top of the struggles of the pandemic and the job market, are going to also be left homeless. But more information will come on that in the coming days and the coming weeks, I'm sure, as that argument is far from over and that discussion is far from over, as evictions will continue to will begin again, and we'll start to see this housing crisis that's been caused by the pandemic really become a major crisis across the U.S. We have more articles on our web. We'll have these articles hopefully all on our website at some point today. If not, you can always find our articles and more helpful information about COVID-19 and more on our website at civiccentertv.com/coronavirus. We have a great show for you today. We'll be speaking with the president of Callie Education coming up next. We'll speak with Professor Dr. Don Matthews from Oakland University later on in the hour. And in the second hour of the show, we'll be speaking with Callie Matteson, Danny Chammas, and then we'll kick off the show later on with another special interview. That's all coming up next on the Megacast. You're watching and listening to us on our family of television, radio, and other media outlets.
Motorcyclists are hard to see. To keep everyone safer, it's important to always look for them and know where most crashes occur. 84% of motorcycle and vehicle crashes happen on streets, not highways. And most crashes with motorcyclists occur when vehicle drivers are turning left. So before turning, especially to the left, make sure you look for motorcyclists. Then look again. It could save a life.
To Sofia and Gabriel. Even though these old knees can't follow on your adventure to the forest today, these flowers represent my love. These stitches and threads join us together. And wherever you see a flower, a bird, a beautiful tree, know that my love is with you.
Make the forest part of your story at a park near you. Find one at discovertheforest.org.
Can I ask you a question?
Why did you get your kids vaccinated?
It was hard for them to social distance, to be isolated from their friends.
I want them to get back to school and sports games. So as a pediatrician, I recommend the vaccine to everyone I know. Ray's lost a former teammate and classmate who was only 20 years old. It's been a devastating year.
We want to get back to normalcy. Our daughter is really looking forward to being with her friends, being a kid.
Welcome back to the Megacast. I'm Tyler Keefe in our studios here in West Bloomfield Township as we continue to talk about a number of different issues and news stories and important topics, of course, related to COVID-19 as this show was born out of the pandemic, but also about a number of other topics that are affecting the people of Oakland County, southeastern Michigan, and the entire Great Lakes state. And one of those chief issues that's definitely related to COVID-19, but also is vitally important to every single one of our communities is education. And one organization is helping to provide some of the talent that is necessary to help provide the great education that our students are able to get here in Oakland County and southeastern Michigan and all throughout the state. And one of those organizations is Callie Education. We're pleased to be joined by Nicola Soares. She is the president of Callie Education with us today on the Megacast. Nicola, thanks for being with us today.
Thank you, Tyler. Thank you for having me.
Appreciate having you on. So as we head into fall and we head into the school year, last year about this time, there was a real struggle, it seemed, or a scramble to try to find the necessary amount of substitute teachers to accommodate another uncertain school year. Heading into this school year, just in the last few months, it seemed like things were going to be a little more positive. We were going to have less of these COVID-19 cases. Things were starting to sort of fizzle out in terms of severe outbreaks of COVID-19 or high community transmission of COVID-19, which is, of course, of great concern when it comes to our teachers and our educators heading toward in-person learning. The case is different now. Right now, our communities, by and large, 81 of the state's 83 counties, are in a high or substantial transmission rate in terms of community spread with COVID-19. So as we're heading into this school year, are we seeing a similar greater need and struggle and scramble to find those substitute teachers that may very well be necessary, especially with in-person learning, by and large being the case this school year?
Yeah, thank you, Tyler. I think the question that you're asking is a really important one, and I would say absolutely. Callie Education is in 45 states across the country, and I would tell you that every single public school district, charter school, independent parochial is in the same situation of needing that instructional talent. But what I will tell you, what we are seeing, yes, we do need to have our substitute teachers in place, but it's the way that they're being used for their talent, meaning that we have just an enormous amount of full-time teacher vacancies that staffing providers are having to fulfill right now. So last year around this time, we saw an increase of about 34%. That year-over-year increase that we're seeing across the country, particularly with our talent pool, has risen to about 50%. So that's 50% of the demand of talent pools that are substitute teachers are now being used to accommodate for those full-time teacher vacancies that our schools can't hire right now because of the shortage. So not only do we have the day-to-day, but we also have the vacancy factor that we're having to support.
Nicola Soares joins us on the Megacast. She is the president of Callie Education. And with that situation being what it is, with there being a greater need now, not only for substitutes, but for full-time teachers, are we finding that because there's so many of those openings across so many different districts, and not only there's that, but there's also the need for substitute teachers in every one of these districts and every one of these county-wide consortiums are looking to fill those positions at the same rate and at the same time with the same urgency. And also given the situation where we've had a lot of teachers that have retired or that have full-on just quit and moved on to different career paths or are refusing to go back in person because of their own concerns for themselves or their families, are we finding it harder across the board to find good candidates, quality candidates, to put the best educators possible in our classrooms for our kids?
Yeah, I definitely think we're definitely challenged by finding the qualified educators that we need, not only in the main sort of academic classrooms from K through 12, but also in our special ed classrooms and so forth. And so unlike all other industries, education is also still, in that same boat as well, which, as a talent provider, given our knowledge, particularly around the science of recruitment and engagement of our candidates to place, it definitely, our operating teams are working 24/7 around the clock, trying to accommodate that needs. It just means that we have to get more creative in the way that we engage and how we find our talent in all the different channels that we have. But I am very encouraged with what I see, because we do see folks coming into the education profession, even if it's on a temporary basis or a full-time basis, that it's very mission-minded. And so we've got a lot of folks that have decided to change careers, as we know, and maybe do something that's more purpose-driven. So we have a lot of those folks. We're starting to also see a lot of younger folks come into the profession as well, what we call momentum seekers. Those are those folks that really would like to define how the way that they want to live in terms of how they want to work. So it might be a combination of different kinds of assignments or different kinds of work opportunities, and substitute teaching really fits that bill, because they get to decide in terms of their schedule or, where they would like to put their focus.
So with that, Nicola, as we're heading into the school year, as we're trying to get in front as much as we can this late in the game of the full-time and substitute teacher needs throughout the state, but focusing mostly here in Oakland County, as we're looking at that, what are our school districts looking for in terms of filling those positions? Because obviously you want someone that has, you'd like to have someone that has education experience, that's taught kids in a certain age group that they may be teaching going into this job or that job, or have some educational background altogether, so that they are more familiar with the ins and outs of being an educator in today's classrooms. But beyond that, as people are shifting into this industry, what are these school districts looking for, and who should be seeking these jobs if they're looking on the market?
Yeah, I would tell you every single state has their different set of credentialing criteria in terms of what it would take to be either a teacher or also a substitute teacher. Michigan, amongst many of the states, have sort of a higher level of credentialing criteria, which is a good thing. I think mostly our school districts or schools in general, they're looking for individuals that, if they come in as a substitute teacher, that they have, usually a minimum of a 4-year degree. But also providers like ourselves, we also provide a lot of training, if you will, and continued education in terms of, supporting instruction, classroom management, what it requires to be a substitute teacher. So always, whether it's a public school district, if it's a staffing provider, are always trying to hire the most credentialed individual with the minimum requirements at a minimum in terms of what it takes to be a substitute teacher. So I would tell you that, those are requirements. They're not skirted around. They are full on a part of the hiring process.
We're joined by Nicola Soares. She is the president of Callie Education with us today on the Megacast. And Callie, I'd also like to discuss the mask mandates as well, because that's beginning to affect our schools, especially here in southeastern Michigan, as Oakland County earlier this week put their own mask mandate in place. It's expected that Wayne County will make a decision on mask mandates in some form today, as they were in discussions late last night as well, and that was reported this morning from the Detroit News that they're expected to make that decision today. How are the COVID-19 regulations that are being put in place by school districts and by local counties, how is that affecting the hiring process? Because for some that would be interested in these jobs, those mandates being in place, those regulations and safeguards being in place would be vitally important. But for others that may not be for those regulations, that could be something that deters them from taking these jobs.
Right. Well, it's masks. It might be the potential of mandatory vaccines as well, right?
Yeah.
Typically, I can speak from our perspective. We always follow the protocol of a particular school or a public school district in terms of mask mandates. What we are seeing across the country, and Oakland County is no different, they are putting mask mandates in place. And why? Because we know that those as a tool works. It prevents disease. We know that it can protect our children, our faculty. And so that's why you see that sort of becoming across the board, particularly for our students that are under the age of 12 and unvaccinated. It's a really important protocol that we have along with all the other safety protocols. Do we see if some folks choose not to do it? Yeah, we do. But for the most part, it's very minimal. We don't see a lot of people just saying, I'm not going to do this because I don't want to wear a mask. So I'm very pleased that a lot of people are adhering to that and understand the requirement and the reasons behind it.
We're joined by Nicola Soares, president of Callie Education, with us today on the Megacast. And Callie, I want to talk to you also about the impact of ESSER funding, or to define that better, elementary and secondary school emergency relief fund funding, and how that is helping to, how that is having an impact on our education system. Because in some cases, it's increasing. There's an increased need for tutors, and there's an increased
Right.
And then those are being used differently from state to state and from institution to institution. How are those funds, especially now as we're heading into another uncertain year, how are those generally being utilized here in Michigan? And what are some of the differences in how those funds are distributed district to district and area to area?
Yeah, I mean, you see it across the board. I think what's key here is the flexibility of those funds and how districts are able to use them. And so it's really, they get to make the decisions in terms of what is best for their particular schools, district. We see that across the country. As an example, $29 billion that were earmarked for tutoring services, which is fantastic. Yeah. And so, what we've seen, we've had folks that are opting to buy sort of virtual tutoring services. Maybe it's software that's being deployed. It's an intervention instructional tool platform. Or you've got other districts that are raising their hand to actually have tutoring services, actual human beings, if you will, that will come in during the school day and to do small group tutoring services, depending on what that need's going to be. What has been very interesting, specifically around tutoring, is that I would say every district agrees that they need to have it as a pillar of instruction. So we have seen that. And actually our services have been in huge demand around that. We just recently did a research study with EdWeek, and we had over 2,500 participants, administrators, teachers, parents, students participating. And what I think the headline for me that was really, really surprising was the difference in terms of perception of how much tutoring services were going to be needed for our children to help with learning recovery. And our not a surprise, but administrators and teachers think that the length of time to actually provide tutoring services is going to last into a couple of years, where parents thought it might be a shorter time period. So, obviously our teachers are very engaged with their students. They realize that many of our schools or students fell behind, particularly when it was in a virtual sort of a situation. So there's a lot of demand and need for tutoring in all shapes and form, if you will. And it's no different here in Michigan. We're seeing a whole variety of different needs and demands for tutoring services, regardless if it's done virtually or by software, by paper, by person. But I'm very pleased that the Biden administration was able to really provide funding that could be flexible in the decision-making and, more importantly, for the next couple of years.
And because of the flexibility of those funds, and I'm not an expert on this, so I want to pick your brain on it, because prior to the pandemic, certainly during the pandemic, and definitely after the pandemic, childcare is going to become a much greater issue. And so can these funds, particularly because they would be executed from school districts, are school districts then able to utilize these funds, or have they in some cases then gone ahead and utilized these funds to provide additional childcare that gives some relief to parents as well, especially for those that are sending their kids back to in-person learning and are then also going back into the office and may not be able to provide that additional child care, or have to potentially leave their jobs to pick their child up from school?
Yeah, we haven't really seen any of that per se. I know that the Biden administration is really talking a lot about funding additional funding for pre-K.
Okay.
So, and that's age 3 and up as an extension of K through 12. So, universally, I think that a lot of folks would agree that that is a critical opportunity for our students, which also would help to accommodate for parents as well.
We're joined by Nicola Soares. She is the president of Callie Education, with us today on the Megacast. And Callie, as we continue on into the school year, and we're looking to get teachers into the classroom, additional teachers in the classroom, substitutes, if people are interested in these jobs, what are the first steps that they should take, particularly for those that don't have education backgrounds necessarily, but also for those that do have education backgrounds and either are recently retired but want to get back in to provide some additional service, or are looking to switch jobs?
Yeah, great question. So the first thing to do, I would say, is log on to your local public school district or different schools' websites, if you will, just to see how you apply and what the credentialing criteria is. Outside of that, you can always come to a staffing provider like ourselves. Like if you go to kellyeducation.com, there's also information on how you can apply to be as a candidate, and then to get additional information in order to be a substitute teacher.
We're joined by Nicola Soares. She is the president of Callie Education, with us on the Megacast, and just a few more minutes with you today before we'll say goodbye. So before we do, is there anything else that would be interesting for our audience to know, or important for our audience to know, about the pursuit of more educators to put in the classroom right now, or other issues that are affecting our educators and our school districts as we head into this new school year?
Yeah, I think what's always not lost on me, I'm a former teacher myself. I started my career that way too. There is a lot of focus on socio-emotional wellness for our students as they've gone through this whole pandemic. Certainly everybody agrees that schools need to stay open, but we need to do it really safely. But I always tell people not to forget about our head learners of the classroom, and those are our teachers. And so when we think about their needs to be supported, in particular, as we go through this whole still a pandemic on the other side and the talent shortages and what have you, we need to be very focused on helping to support our teachers. So if it's a service like this that helps to support their instructional needs, if it's recognition, incentives, whatever it takes, we really need to be focused to our head learners of the classroom as well.
And Nicola, where can people find more information about Callie Education and Callie services, and maybe engage with your organization to provide the information that they need, or some guidance on maybe helping them fill those jobs that are open in our education format across our local area?
Sure. If you come to our website, kellyeducation.com, we have all of the information right there. And we have folks that can engage immediately and to give any public school district, charter school, private independent, any information that they need. So not only do we do substitute teachers, but also all of our food and nutritional services, IT services, school nursing, therapy, tutoring, and so forth. So, and paraeducators. So it's all right there. So, we're willing and waiting to help. So thank you so much, Tyler, for having me as a guest today. It was a privilege to be able to speak to your audience.
We appreciate having you on as well. Thank you. We appreciate Nicola Soares, the president of Callie Education, with us today on the Megacast. We're going to take a quick break, and on the other side, we're going to transition from issues in the classroom to issues of national security and defense, and really of history as well. We have a crisis going on in Afghanistan as President Joe Biden's administration has begun to pull our troops out of Afghanistan after a long 20-plus years they're fighting and rebuilding, or attempting to help rebuild Afghanistan following the war on terror. And so we're going to talk to him about the history of the Taliban and the resurgence now of the Taliban, as well as why the origins and the effects of the crisis that we're having pulling our troops out of Afghanistan. We'll speak with Dr. Don Matthews from the Oakland University History Department coming up next after this break. You're watching and listening to the Megacast.
When times get dark, we can't see the help that's all around us. When you don't know where to turn, let 211 be your guiding light.
How can I help you?
Our guides are ready to connect you with the help you need. For help with food, healthcare, mental health, and other resources. Call 211. or visit 211.org. 211. Get connected, get help.
People are getting out to walk and bike in higher numbers. More vulnerable road users and higher speed traffic can be a dangerous combination. Crash severity has increased, so if you're driving, be sure to slow down and look for people. There's no need to speed. If you're biking, ride with traffic. If you're walking, avoid stepping into the road if possible. If you have to walk in the street, walk facing traffic. Learn more at walkbikedrivesafe.org.
Welcome back to the Megacast. I'm Tyler Keefe in our studios here in West Bloomfield Township alongside our board operator and studio producer, Calvin Brown, as we continue to bring you news and information from throughout the Oakland County area and across the state of Michigan, issues that affect all of us here in the Great Lakes state and really in some ways regarding COVID-19 and other issues across the world as well. And certainly the situation in Afghanistan right now regarding U.S. troops pulling out of Afghanistan after a long stay over there and long amounts of service over there, and some of the issues that are compounding from that exit are certainly issues that are affecting people all across the world. Certainly our troops that include a lot of people that are from here in the Great Lakes state. And to talk more about that issue and get some insight from experts that with expertise in the history of the Middle East and of Afghanistan. We're pleased to be joined by Dr. Don Matthews. He's a history professor at Oakland University with us now on the Megacast. Dr. Matthews, thank you for being with us today.
Thank you.
So let's begin with the Taliban, because we're hearing a lot more about the Taliban now than we have in recent years, especially as the U.S. troops are pulling out and the Taliban's sort of having a resurgence of power there in Afghanistan. So let's go back to the origins of the Taliban, because the U.S. does have some relation to those origins, and they kind of play a role in the Taliban coming to light. Is that correct?
Yeah, that's true, and I would put it in a little bit bigger context.
Okay.
That Afghanistan has now for a very long time been an area of conflict, in large part, that's because since about 1978, it's been in the interest of one state or another to rather have no government or no effective government in Afghanistan, rather than to have a government that is influenced by one of these states' opponents. So during the period of the, prior to the Cold War, essentially, Afghanistan from the 1890s was really kind of a buffer between the Russian Empire and between British India. And after World War I, it maintained that buffer area with British influence. But with the Cold War, it became really a neutral state in the Cold War, where both the Soviet Union and the United States influenced that government there, but it was aligned until 1979 or 1978, really with neither the United States or the Soviet Union. But in 1978, what took place there was called the Sour Revolution, which was a Marxist government seized power there. There was infighting within that Marxist government, and the Soviets basically settled that with an invasion in December of 1979. And within a few months, the Carter administration then decided to back the Afghan Mujahideen guerrilla forces, Islamist guerrilla forces, to prevent the Soviet Union from dominating Afghanistan, or at least to raise the cost of them for doing that. And so essentially, rather than have Afghanistan become something like the 16th Soviet Socialist Republic, the United States, first in the Carter administration, then the Reagan administration, was quite happy to see a failed state rather than a successful state. So after the Cold War was over and the Soviets withdrew from Afghanistan, they withdrew in 1989, then it left the situation where there was no central authority in Afghanistan. And this is worrisome to Pakistan. So Pakistan really became the next state that had an interest in seeing that no government that was its enemy, that it was its opponent became dominant in Afghanistan. And Pakistan, of course, largely was worried about India. And so the instrument of Pakistan in Afghanistan became the Taliban, which was effectively organized by Pakistan and financed by Pakistan through its intelligence services known as ISI. And so the Taliban were rather good at preventing opponents of Pakistan from establishing themselves in Afghanistan. They're very bad at building a state. So by 1994, the Taliban had Pakistani backing. By 1996, they controlled roughly the southern 2/3 of the country, and so there was really no effective state there. So it means then that Al-Qaeda, as a terrorist organization, Islamist global jihadist organization, it was able to establish itself there in this kind of vacuum. And so when the United States then launched this war in Afghanistan in October of 2001, it went from being a counter-terrorist operation to becoming a kind of counterinsurgency operation, which implied state building. So still, Pakistan had to worry that the state that came into being in Afghanistan might open itself to Indian influence or to other influence that was not to Pakistan's advantage. So they continued to back the Taliban. So it means then that they've successfully thwarted that roughly 20-year enterprise of American state building in Afghanistan. So where we are now essentially is that government that the United States failed to build. It dissolved essentially, and the Taliban have been the main agent in destroying it, and they've enjoyed episodically and periodically, a great deal of support from Pakistan in doing that. So now again, we're faced with what looks like pretty much a failed state there.
We're joined by Dr. Don Matthews. He is the professor of history at Oakland University with expertise in the Middle East and Afghanistan. And because there was, of course, in the Trump administration, he had announced previously during his administration plans to pull troops out of Afghanistan with the goal being, I believe, if I'm correct, September 11th of this year. And then
that was Biden's deadline, yes.
Yes, and so President Biden's President Biden's deadline. So as we're making that transition out of Afghanistan, it becomes a lot easier then, I would presume, for these other countries to begin having those influences and putting those that are in their favor back into positions of power. Does the speed at which we are bringing troops out of Afghanistan add to that element of chaos with the failed state that's inherently there when you have any failed state? And is that contributing more than anything else to kind of the chaotic situation that we're currently seeing in Afghanistan in terms of pulling our troops and others that have been working with our government out of Afghanistan?
Yeah, I think there's no doubt about that. And I mean, it was never a successful state. No. As long as the United States was there, and so it was already a failed state, it just collapsed, I think, more rapidly than most people would have expected. And so one of the things that it meant, of course, is that the Biden administration was hoping that that state would last longer, much longer. So the question becomes then, how do you evacuate your the personnel that have cooperated with you without signaling to the rest of the state that you're pulling your support and then precipitate its rapid collapse? So that was a question of timing there, which unfortunately did not play itself out to the American advantage or to the advantage of the Afghani government. And it means then that our withdrawal is taking place under circumstances of both chaos and obviously there's terrible dangers exemplified in the awful bombing that took place yesterday.
Dr. Matthews, should this have been expected, even if not necessarily at the scale that we're seeing? Should this have been something that was expected? And did the U.S. government, do you believe, with the situation that we're in, that they have a failure in planning as they were planning to withdraw troops of dealing with a situation like this? Because as you're exiting a situation like that, especially with a situation where there is a failed state and there is consistent interest from other nations, neighboring nations, and those that may be in some ways combative with the U.S., should that have been more of a consideration so that we could have prevented a situation like this?
Yeah, well, it's hard to imagine how you would prevent something like this from happening, because as I was just pointing out, it's this question of timing. If you give yourself a long lead time, then you're signaling to the state itself that you're withdrawing support, and they're on their own, and that's going to accelerate the process. It's reasonable to expect, at least, that would accelerate the process by which the state would collapse. If, on the other hand, you don't signal that and you do it in a compressed time period, then that means also that this creates very difficult situations for getting out your own personnel and for the Afghani personnel that were working with the United States. So conceivably, there's someone out there that might have known how to do this better, but it's just a massive challenge. It's just hard to imagine how you can do this smoothly and safely. It's by its nature, it's extremely dangerous.
We're joined by Dr. Don Matthews. He's an Oakland University history professor with expertise in Middle Eastern and Afghanistani history, joining us today on the Megacast. And we've seen throughout history, and you talked about this when we discussed the origins of the Taliban and kind of what led up to the situation, whether it be the Russians, whether it be the Americans, Pakistanis, or so on. There always seems to be some sort of a conflict or some sort of a battle, whether it be with outside nations or just internally in this region, particularly in Afghanistan. Why is that the situation, do you believe?
Yeah, that gets back to the point I was just making, is that for a very long time now, it's been in the interest of one or more states to prevent a government in Afghanistan that might be influenced by the opponents of one of those states. So, at first, going back to about 1978, this has been true. So, after 1980, with the Soviet invasion, it was in the United States' interest to see to it that the Soviets could not build a successful state in Afghanistan. The United States did not have to worry so much about what came next. It was a matter about blocking the Soviets. So especially after the revolution in Iran, that was completed by January 1979, or at least the collapse of the Shah's regime was completed by January of 1979. The United States very much was worried that in a case where there was chaos in Iran and a Soviet presence next door in Afghanistan, then that would open the door to Soviet influence in Iran and position the Soviets there right along the Persian Gulf, in this area that was so strategically and economically important to the United States. And in fact, President Carter issued a presidential doctrine of this called, of course, the Carter Doctrine, which basically said the United States prevent any outside power, meaning the Soviet Union, from bringing the Persian Gulf region under its control. So the whole goal then of backing the Afghani resistance was not to build an alternative state, but basically to tie up and raise the cost of the Soviets of being there and prevent them from expanding further towards the Persian Gulf. So after the Americans leave, then the Pakistanis, they face a similar situation there. So part of their challenge is that next door in India, the Pakistanis have been supportive of Kashmiri independence. They have to worry that the Indians will do the same thing to the Pakistanis, because in the northwestern Pakistani provinces, there are large Pashtun populations there, some of which would like to break away from Pakistan and join with their fellow Pashtuns in Afghanistan. They could foresee a situation by which India would do that to them. So Pakistan didn't care so much whether there would be a state built in Afghanistan, but whether whatever order came next would provide an environment for India. So essentially, what has happened is that Pakistan has been a place where countries have pumped weapons to the various proxies inside there, and has prevented a central government from being formed. So that creates a sort of a perpetual conflict situation.
We're joined by Dr. Don Matthews, Oakland University history professor with expertise in Middle Eastern and Afghanistan's history, joining us today on the Megacast. And we can't focus on an issue like this. It's easy for us to focus on an issue such as what's currently going on in Afghanistan from the American perspective, and talk about our troops and talk about our national security and defense interests in the region. But we also need to have some sort of focus be put on the humanitarian interests of the people in Afghanistan who are obviously going to be affected by these constant changes. What needs to happen for them to be able to have, I'm trying to think about what we can do either from the United States perspective during this transition to prevent this from putting further harm on the people of Afghanistan, or at the very least, do you see a path forward where the people of Afghanistan can find some sort of peace in their home without leaving their home or having to be forcibly removed from their home or in some other situation? Is there any way that they can find peace in their home region without this influence from outside nations continuing to cause this chaos in Afghanistan?
Yeah, this is a really good question. And right now, it looks like Afghanistan has set itself up, or the circumstances have set Afghanistan up to continue as a failed state, in part because the Taliban themselves, as we can tell, are not terribly unified. And then already we see some of the warlords in the northern part of the country have organized opposition. So, on that level, internally, the prospect doesn't look good of bringing peace and stable government to Afghanistan. But what does look better is that a number of countries now then have a common shared interest. Even though these countries do not get along necessarily with one another, they have increasingly shared interest in seeing to it that there is some sort of stable government in Afghanistan. So, for example, Iran, which both hates and fears the Taliban, now apparently recognizes that there are worse things out there than the Taliban possibly. So, for example, ISIS-K, which is taking responsibility for the bombing yesterday. The K in ISIS-K, of course, stands for Khorasan, which is a northeastern Iranian area. That means that this group has territorial designs on Iran. This is very worrisome to them. So Iran has an interest in seeing the Taliban successfully consolidate rule, maybe a coalition government in Afghanistan. And in fact, Iran in the last few days has agreed to sell fuel, refined products like gasoline, to the Taliban government. Then Pakistan as well has to live with sort of the consequences of its success. So groups like the Taliban in Pakistan, which is a different Taliban, which opposes Pakistan, they might start operating from Afghanistan against Pakistan. So Pakistan also starts having an interest in seeing to it finally that there might be some sort of stable government in Pakistan. And this is also the case with China, which is a strategic rival to the United States, has an adversarial relationship with the United States. But China has to worry that Afghanistan can become an area of operation, an area of organization from its Western Muslim population, its Uyghur Turks. So from China's point of view, it's also to its advantage that Afghanistan form a unified government. And so, of course, the United States as well, to the extent that it can see a unified government in Afghanistan, it might be able to deny staging areas and areas of operation to these various global jihadi groups that can threaten the United States. So one good thing that we can see, at least for now, is that whereas in the past there have been these countries in the neighborhood for whom it's been their interest not to have a stable government in Afghanistan, now a lot of the international community is starting to converge around the idea that the best thing that could happen would be that Afghanistan does in fact successfully form a government, even if the Taliban is at the center of it.
You're listening to your radio home for the Megacast, 89.3 WBLD Orchard Lake and 88.1 WBFH Bloomfield Hills. We're joined by Dr. Don Matthews from the History Department at Oakland University. And Dr. Matthews, there are a number of lessons that we can learn from this conflict and from the history of the region there in Afghanistan and the Middle East. But specifically with this current crisis and really going back as far as the onset of the war on terror, what are some lessons that particularly the U.S. government, but really the world, should be learning from a historical perspective from what we have seen and in many ways what we have caused to happen in Afghanistan?
Yeah, I think you framed the question very well here. And I think one of the things that, one of the conclusions that we can draw is that the American global war on terror, which has been waged for the last 20 years, is a complete failure. That it was poorly conceived, that it was built upon flawed ideas. Now, the heart of that global war on terror was basically a return to the policy of counterinsurgency, which implied state building. And so far, the United States has had pretty close to zero success in building states. In fact, we have seen the opposite. And during the course of the global war on terror pursued by the United States, we've seen the creation of a belt of failed states from Libya, Syria, Yemen, Iraq somewhat, at least I should say, Afghanistan, even to some degree in Lebanon. So that is not succeeding. So the idea of the global war on terror was the United States would either force governments that gave haven to jihadi terrorist organizations, force them to deny them sanctuary, force those governments to deny them sanctuary, or the United States would build stable and hopefully democratic governments in places from which these had operated. So that's been kind of a fool's errand. We've not even come close to that. And if you think about it, it's just a massive undertaking. So there's really poorly governed or ungoverned land all the way across North Africa, from basically Mali to Afghanistan. It's a massive area there. And in fact, we don't talk about this, but the global war on terror is taking place in places like the African Sahel. Back in 2017, 4 American Special Forces troops and 2 were killed and 2 wounded in a clash with a Al-Qaeda affiliate in the North African country of Niger. So it's just been this sprawling and ultimately unsuccessful enterprise. So I think one of the things that the United States has to recognize from this is that, one, the counterinsurgency campaign as part of the global war on terror has failed, and the strategy of backing proxies in these local civil wars, particularly in places like Syria, is a very good example of this. This has also failed to produce areas that would reduce terrorism. It's probably had an opposite effect. The one thing that these wars have produced have been very large numbers of refugees and people living in very desperate economic circumstances. So I'm hoping that the United States is going to go back and rethink this entirely.
We're joined by Dr. Don Matthews, Oakland University history professor on the Megacast. Dr. Matthews, thank you very much for being with us today.
Thank you.
Appreciate you joining us and appreciate your perspective here as we try to put some history into what's going on in Afghanistan right now with the American troops pulling out after the global war on terror, as well as how this affects the people of Afghanistan, because war doesn't just affect the war. The history is usually told from the perspective of the winners, and if we focus only on the United States, considering this a win, which in some ways sure, but in some ways definitely not, we want to make sure we don't forget about the historical perspective of those in Afghanistan and hopefully learn our lessons going forward in state building or in assisting with state building and with decisions to go to war, knowing that this affects people across the world, not just here in the U.S. We're going to take a break. On the other side of the break, we're going to transition into the second hour of the program and talk about a family that's been affected by rare disease, Arteriovenous Malformation, or AVM. We'll speak with Callie Matteson and Kirsten Abbott about that after the break. You're watching and listening to the Megacast.
Parents do a lot of worrying. Get your kids caught up on childhood vaccines to protect them from these 14 preventable diseases, and you'll have 14 fewer things to worry about. Vaccines are safe and effective and save lives. So let's get caught up on vaccines and worry about something else. Get the facts at ivaccinate.org.
One of the things you can look for in your friends is a change in behavior.
These can be big changes, they can be small changes in mood, physical appearance.
They may be sleeping less or sleeping more, drinking more, or their eating patterns may be different.
One big change that can be pretty obvious is change in motivation. Do they no longer want to play basketball? Do they no longer want to play video games?
Now that we're spending more time online and in virtual settings, it's really important to pay attention to the language that your friend is using and the words they're using to communicate.
So when we text our friends, are they taking longer amounts of time to respond? Are they not responding at all? You don't have to be an expert to try to recognize these signs. The second that you feel it in your gut and that you're concerned, that's the second to have the conversation and open the door to what might be going on.
Today, it is easier than ever to join Michigan's Organ Donor Registry and help build a bridge of hope for organ, tissue, and eye donation. Just one person can potentially save or help improve the lives of up to 75 people. By joining, your legacy could be the gift of life. Sign up today at michigan.gov/SOS or at any of the more than 145 Secretary of State self-service stations located across Michigan. Be part of Michigan's Bridge of Hope by adding your name to the Organ Donor Registry.
Welcome back to the Megacast. I'm Tyler Keefe in our studios in West Bloomfield Township as we continue to talk about COVID-19 and other interesting and important topics that affect people not only in our community but all throughout the state of Michigan and across the world as well. And it's not common that you say you're 1 in 200,000 in anything, but in some cases it's for things that you'd rather not be 1 in 200,000, but it's important for our communities to know about those cases as well. And that's certainly the case with Nicola Matteson, a 9-year-old from Commerce Township who's afflicted with Arteriovenous Malformation, or AVM. We're pleased to be joined now by Callie Matteson, his mother, as well as Kirsten Abbott, joining us on the Megacast to talk about AVM. Thank you for being with us today.
Thank you for having us.
Appreciate having the two of you on. So to start, let's just talk about what AVM is and how your story with Nicholas's case came to be, and how you kind of discovered what his affliction was, as well as what this disease is.
Okay, so an AVM is basically an abnormal connection between arteries and veins in the brain. It's basically when the arteries and veins get tangled up and it forms a mass that, like on a MRI, looks like a tumor. A lot of times you don't find out this happens until the AVM ruptures. And when that happens, it's a very critical situation, which is what happened to my son. He was completely fine. And then within 2 minutes, he had a serious headache and he was sweating profusely, and he passed out. And, we rushed him to the emergency room and they weren't sure what was wrong with him. They intubated him and got him a CT scan right away. And that's when they told us that he had a massive brain bleed near the brainstem and a large mass on his brain. They didn't really have any other answers for us other than that. They said that U of M helicopter was on its way to take him there because they were better equipped to handle it.
We were lucky enough that we had one of the best hospitals in the country, just 30 minutes away though.
Yeah, exactly.
We're joined by Callie Matteson and Kirsten Abbott to speak about AVM, or Arteriovenous Malformation, which afflicts, of course, Nicola Matteson, a direct family member of theirs, who is 9 years old, out of Commerce Township. So in terms of Nick's treatment, how long was he in treatment for this, and what is his status right now?
Right now, he's stable and he's home. We're just waiting for his big surgery to remove the AVM. He spent 16 days in the ICU at Children's Mott in U of M. They basically just stabilized him, and he had a shunt in during that time to drain the blood from around the brain that was left from the hemorrhage. We have to wait until all the blood is gone and reabsorbed by the brain to be safe to remove the AVM. He just had a scan on Sunday, and that showed that it's now at a safe level to do surgery. So they're going to be doing surgery at the beginning of September. He has a lot of emotional and behavioral problems from this now. This was very traumatic. He's attending school right now, but he's only made it a couple hours every day before he ends up getting a really bad headache, and his eyes are hurting and he has to come home.
Anxiety.
Yeah. So we're just waiting for the surgery at this point.
And from what your conversations have been with the doctors regarding this surgery, what did they expect to be the recovery time for Nick afterward, and should the surgery itself, removing that mass, provide some relief to him, particularly with those behavioral issues that have mounted from, of course, from the trauma of this, but also just from the effects on the brain?
Yeah, he's really fortunate because his AVM is in the cerebellum, and the cerebellum, it's a really forgiving part of the brain. It can heal itself. It controls balance and coordination. So our surgeon is really confident that when he goes in and removes this, that Nick is going to have a very speedy recovery. Like, he'll probably only be in the ICU for a matter of days. And then he's saying by October, he should be completely back to normal. Like, he's not going to have pain anymore. He will no longer be at risk for another bleed like this. Like, he should be able to go back to a normal life once this is removed.
Well, that's certainly good news to hear, and yeah. Hopefully we'll hear of more good news in the future for Nick as he goes through this process and has his surgery, and certainly through his recovery from his surgery. We're joined by Callie Matteson and Kirsten Abbott, who are family members of Nick Matteson. Of course, Callie is his mother. Nick Matteson, a 9-year-old out of Commerce Township, who is afflicted with arteriovenous malformation, will undergo surgery soon. But there is a fundraiser that's going on tonight. It began already today, but it's going on until 7 o'clock tonight at Michigan Made Nutrition's location in White Lake. For those that are interested in contributing to that fundraiser in one way or another, what can they expect to be happening out there at that location? Are they taking certain donations, and what overall is the purpose of this fundraiser?
They're 20% of their proceeds today are going to the fundraiser for Nick, and they had a raffle going that people put in on for it, and then they also were just accepting donations. The money is going to be used for medical bills. Our son does not have Medicaid, so we're responsible for a large portion of every test and everything they've done. It's really overwhelming.
And Justin had to take off work for a month.
My husband, of course, yes, took off work because we were down in Ann Arbor for 3 weeks. Basically, it's just to help us financially right now.
And she's also had to pay for childcare for 3 children.
Oh, yes. My other children were staying with my sister. So, we were helping them with caring for them, of course.
We're joined by Callie Matteson and Kirsten Abbott with us today on the Megacast. And in terms of that support that you have received, of course, from Michigan Made Nutrition, and from those that are helping to support Nick's surgery, and of course the medical bills that are going along with it, because as you said, he is not covered by Medicaid for the surgery. What do you have to say to those that are providing that critical help to Nick during this time as he goes through, as you said, a traumatizing process that you hope no kid ever has to go through?
We're so grateful to everybody in the community who has shown us support, and it's just overwhelming how kind people have been to us. And we honestly just couldn't appreciate it more. Like these people at Michigan Made Nutrition, they came to us and asked us if they could do this for us, and it just means so much. I really just can't thank them enough.
It just shows the good in humanity. It really can shine through at times.
Yeah, it really does.
So Callie, Kirsten, we have a few more minutes with you today before we'll say goodbye. But as we head into this fundraiser that's going on throughout the day, it's until 7 o'clock tonight at Michigan Made Nutrition and their location on Nordic Drive in White Lake. As people are considering donating or considering contributing to this fundraiser, and hopefully raising more awareness about AVM and this condition that affects less than 200,000 people in the U.S. each year. Tell us a little bit about Nick. Obviously, as you said earlier, there's been some behavioral issues that have arisen because of the trauma of this event, and because of the way that this is obviously affecting a young child. This is something that no child should ever have to go through, and this is going to have a large toll. But before this condition popped up, tell us a little bit about what Nick was like and what he is like.
Nicholas is a really sweet boy. He's friends with everybody. Everywhere I go, he makes a friend. He's, very helpful. He was just a completely happy, normal, healthy 9-year-old boy before this. But I do want to make a point to mention that for the last 2 years, he had been complaining of serious ear pain and also like squinting his eyes a lot and
light sensitivity.
And so I brought him to the doctors many times about his ears and was always told there's nothing wrong with his ears. I've mentioned this to the surgeon, like, could this be related? He said that he didn't think so, but from talking to other parents with children with AVMs, I've come to learn that they also were experiencing serious ear pain, like for years leading up to their rupture. The whole point here is there's not enough research being done on AVMs because it's so rare, and
doctors don't even know. That's
right. They don't really know what to tell us. They don't know. So I consider that a warning sign. Like there were things like now that this has happened that I know were warning signs now of this going to happen. Like he was really clumsy and fell down a lot. Well, that makes sense now because it's in his cerebellum. The ear pain, the headaches, the
light sensitivity.
Yes, like all of this happens to everybody who goes through this.
The biggest problem is, though, the majority of doctors don't know anything about it. The few doctors that do know about it, they don't know much.
Right.
So it's more of a community of families that have gone through this that are giving information to each other.
And for the record, the statistics are not accurate. We are finding out from talking to other parents and from talking to some of the foundations that are going on right now. They're publishing new studies. Like they just published one in May of this year, but there's going to be more to come. Once these are published, the statistics and everything are going to change on this because it's not as rare as people think, and this really can happen to anybody at any time. And my whole goal is, we need to have earlier detection. Like there needs to be a way to know that this is happening to somebody before it ruptures.
It needs to be at 5 years old before kindergarten, they get scanned before they go to school, get an MRI. It should be included in insurance. It should be necessary.
So there's this foundation, researchforryan.org, and they're by far my favorite foundation that's doing amazing work for the AVM community right now. And they have several doctors that they've hired for several years now that have been doing clinical research on mice, and they've successfully given mice true AVMs, and they've been studying the effects and like how this happens.
And when it forms.
Yes, and so now we know that this forms during weeks 4 and 10 of pregnancy, and if you look online, they were assuming that it possibly happens during pregnancy or early childhood, but now we know for sure. It's not like you wake up one day and you have an AVM, like you're born with this. So like this, so basically this foundation, they're working to, they want to have early detection made possible. And so all of the donations to this organization, it goes directly to the doctors working on this, specifically Dr. Chen. And yeah, I just wanted to make that foundation known. It's really
going towards critical research salaries. It's going towards animal testing, supplies, equipment, lab. I mean, it's needed. It's
We've
necessary.
learned so much, and it's from this group that's been doing all this research, and it's just amazing what we're learning.
We're joined by Callie Matteson and Kirsten Abbott, who are the mother and the aunt of Nicola Matteson, who is a 9-year-old from Commerce Township afflicted with Arteriovenous Malformation, or AVM. Of course, there's a fundraiser going on through Michigan Made Nutrition, going on now until 7 o'clock tonight at their location at 901 Nordic Drive in White Lake. Again, that's 901 Nordic Drive in White Lake, and that fundraiser going directly to funds to, of course, pay for the testing and the surgery that Nick is undergoing to treat his AVM. And of course, the organizations that the two of you talked about, Research for Ryan, also doing great work to put this research out there to support these families, because, like you said, a lot of these doctors don't know about rare diseases like AVM and other rare diseases as well, or if they do, they have very little information, and often it is these kinds of organizations that are specifically focusing on these rare diseases that are putting the lion's share of that research out there, and in some ways maybe even helping these doctors on a more localized level treat
100%.
these diseases and learn about it, because ultimately it's their duty and their job to help these patients and to treat these patients and help them get through this situation, and they need that information as well. So if you can support, of course, the Matteson family at this fundraiser at Michigan Made Nutrition today through 7 o'clock tonight at their location in White Lake, certainly. And then if you want to learn more about Research for Ryan and that organization that's doing great AVM research, it's an AVM research foundation. Their website is researchforryan.org. Research, the number 4, Ryan.org, and we'll put a link to that organization's website in our description for this interview as well. So Callie, Kirsten, we appreciate you joining us today, and wish you, your family, and of course Nicholas the best during this process, and hopefully a speedy and successful recovery and life going forward.
Thank you so much for your time. We appreciate it.
Thank you for spreading awareness.
Yes, thank you.
Absolutely. We appreciate your time as well. For more on AVM research and that foundation, again, researchforryan.org, the fundraiser at Michigan Made Nutrition to support the Matteson family as they're paying for the medical bills for treatment and for testing and everything that's going into Nicholas's AVM treatment. You can find that at their location, Michigan Made Nutrition's location, at 901 Nordic Drive in White Lake. We're going to take a quick break, and on the other side, we've got more great news and information coming to you. We've got another interview coming up next with the Director of Food Operations at Steve's Mediterranean. Danny Chammas joins us next. You're watching and listening to the Megacast.
How does marijuana affect the teen brain?
Our brains are still developing into our 20s.
With regular use, marijuana can affect teen brain development.
It can affect our brain's circuitry and blood flow and impair thinking, learning, and memory function,
which could hold us back from reaching our potential.
Don't let marijuana mess with your brain.
Get the facts at michigan.gov/drug-free.
I couldn't breathe at all. There was lots of talk about putting me on a ventilator. I thought I was gonna die. I was 39 weeks pregnant and had a scheduled C-section. During that time, I got COVID and was hospitalized for a month. I had a blood clot in my lungs. It caused me to go into right-sided heart failure. I was really scared. I kept texting my husband and my mom, telling them how scared I was, and I was worried that he was gonna grow up without a mom. And then I was worried when I did get home, that he wouldn't know who I was. You know, being 27 and a mom and a wife and having that all almost taken away from me. It's scary, and if a vaccine can prevent that from happening, why not? Get your vaccine. I don't want this to happen to anybody else.
A message from the staff of Michigan's Crime Victim Compensation Program.
Anyone can be a victim of crime
and suffer lasting trauma, physically, emotionally, and financially.
But you are not alone.
If you're struggling financially due to a crime,
we're here
for you. Find out if you qualify for crime victim compensation.
Call 877-251-7373 or visit michigan.gov/crime-victim.
A message from the Michigan Department of Health and Human Services, Division of Victim Services.
Welcome back to the Megacast. I'm Tyler Keefe in our studios in the West Bloomfield Township at the Green Media Center on the campus of Chico Elementary. Pleased to be joined, of course, every day. We're with you on Civic Center TV, our flagship television station. We're also on Birmingham Area Municipal Access, both for our TV channels on Comcast, Channel 15, and AT&T Channel 99. Find us on the radio each and every day, 89.3 Lakes FM and lakesfm.com, as well as 88.1 WBFH, the Biff, and on their website at wbfh.fm. Find us online in HD on civiccentertv.com, as well as on My Michigan TV, which you can not only find online on your web browser at mymitv.com, mymitv.com, or mymytv.com. You can also get My Michigan TV right here on your cell phone, as well as on your smart TV. It's in a number of different app stores, both on a number of smart TV applications, as well as on your mobile phone in the Android store, as well as the Apple App Store as well. Find more information, of course, on MyMy at mymitv.com, and find us also on Facebook via Facebook Live each and every day. On our Facebook pages, Civic Center TV 15 and Lakes FM. We're pleased to be joined now by Danny Chammas. He is the Director of Food Operations at Steve's Mediterranean with us today on the Megacast. And in 2013, Steve's Mediterranean had its products in 40 different grocery stores in the state of Michigan. Man, has it boomed since then. Now they're in 250 different grocery stores throughout the state of Michigan. We're pleased to be joined, of course, by Danny Chammas. Danny, thank you for being with us today.
Oh, yeah. Thank you for having me.
Appreciate having you on. So for those that are unfamiliar with Steve's Mediterranean, tell us a little bit about your products that you provide and what makes them special.
Well, first of all of our stuff is handmade. Besides our machines that mix like the hummus and other things like that, all of our stuff is hand mixed, and then we don't have any automated machines for like line packing. There's a real person putting labels on every package, and somebody's putting all the product in those containers with their hands. Our biggest item obviously is our original hummus, but we do a lot of salads. Santa Fe is really good and really popular. A lot of people like that. Lentil and rice. And we also do other Mediterranean things like tzatziki, and we have baba ganoush, which is pretty, like, a lot of people don't know what it is, but when they try it, they really like it. It's eggplant instead of chickpea. Otherwise, it's almost the same as hummus, but as soon as people try it, they like it a lot.
We're joined by Danny Chammas, the Director of Food Operations at Steve's Mediterranean, with us today on the Megacast. And as you said, Danny, all of your products, or the vast majority of your products, are handmade, and they're and with very few products, like you said, just the mixing of the hummus and other things like that are used with machines. And so during the pandemic, because that is such an intimate process to have handmade foods be produced, what challenges did your company face in continuing to produce these materials, especially now that you are in so many different grocery stores throughout the state of Michigan?
Yeah, like a lot of other places, we did right when things started getting bad. We almost stopped completely, but we never weren't producing anything. But our biggest problem, obviously, is the employees. You know, it's hard because people are afraid, and for good reason. But still, they don't want to come to work and be around people, and that really has been our biggest problem. You know, like, we lost a lot of good people that had been with us for a long time because they weren't comfortable with how close everybody needs to be in our production area. Like, as far as the line goes, they're really standing right next to each other. So everybody has to wear a mask, and we're keeping it that way. We've never, even when the mandate was lifted, we still just ask our employees to please just wear their mask, and nobody really seems to have a problem with that. But the biggest thing is definitely getting people to show up and getting new people.
And so how is the staffing situation right now? Because we know a lot of companies in food services, certainly in restaurants and retail, are having a lot of issues keeping a full staff or near full staff to be working at as high operations as possible, as close to normal as possible. Are you experiencing those similar issues, or has staff retention been fine for Steve's Mediterranean during this pandemic?
No, we've definitely had those similar problems. We can't really find anybody new, and we've lost a good amount of employees that I would say we're about 60% of where we were before the pandemic started as total employees.
We're joined by Danny Chammas. He's the director of food operations at Steve's Mediterranean. So right now, in terms of those staffing needs, what positions are available, and what are you really looking for in terms of potential employees to bring into Steve's Mediterranean? What are some of the draws to the job?
Well, the best part I think about our job is you really don't need any experience to start working here. Like none of the things we do are, besides a few things, are really like labor intensive. So it's a relaxed job. There's no real. It's not a stressful job. It's not a stressful environment, and we can accommodate to, if an employee has a disability, say, or they just can't find a job other places, we require no prior experience, and the training process is very simple. Almost everything we do is very straightforward, and we're looking mainly for people that just want to work. Like we can train anyone to do any of the stuff. We just need people that are gonna show up and have a good attitude and just be ready to learn a little bit. Like I said, there's not too much that goes into everything. Almost everything is very simple, very straightforward, but it's just getting the people to show up in the first place and then coming back if they do show up the first time.
We're joined by Danny Chammas on the Megacast. He is the director of food operations at Steve's Mediterranean, and it's a family business. Your father Pierre is the owner of the company, and so and it's an individual company too. It's not something that's part of a larger corporation where you have much more of a fixated system of operations and all that too. So you have that support system also there. That it's a family-owned business that understands the importance of having family be involved in the business and that of its employees. So it creates more of a welcoming environment, right?
Mm-hmm. I would say so, yeah. I'm here every day. My brother also is working in production with me, doing almost everything just like I am. And then 2 out of 3 of my sisters are in the office. One of them is doing customer service and our HR department kind of. And then the other one is taking care of like the bill side of paperwork, office work, stuff like that. So it's really nice actually seeing everybody all the time here at work, because it gets with the lack of employees, it's stressful on my dad a lot, and me, my brother, and it's nice having my family there where we can help each other out, calm each other down, and just get through the problems that we're having together.
We're joined by Danny Chammas, the director of food operations at Steve's Mediterranean, with us today on the Megacast. So your products were in 40 grocery stores in the state of Michigan in 2013. Currently, they're in over 250 stores throughout the state of Michigan, and that's some large growth in just 8 years, from 40 to 250 grocery stores. What do you believe has been the key to Steve's Mediterranean, being able to have that sort of expansion, being a Michigan company and expanding to that many Michigan stores?
Well, I would say that it's mainly due to the quality of our products. We don't take shortcuts. We put quality ingredients in all of our product. The hummus especially is we purchase top of the line tahini, and you can taste it. And we put a good amount of tahini in there too. So like that just our food tastes really good, and the as long as the quality stays up where it is, then I don't think we're going to have any issues with keeping the customers that we do have, and I think we'll just continue to grow as long as that doesn't change.
We're joined by Danny Chammas. He is the Director of Food Operations at Steve's Mediterranean in more than 250 stores here in the state of Michigan. In the local area, you can find them in places such as Kroger, Meijer, Nino Salvaggio, Johnny Pomodoro's, Papa Joe's Market, Holiday Market, and Westbourne Market. And restaurants that they began serving include Leo's Coney Island and many Detroit casino hotels. And so, Danny, I have to ask you, being that you're on the front lines, you're the Director of Food Operations, the food itself is what you do, is what you're overseeing. I got to ask, what are your let's say your two favorite products from Steve's Mediterranean? What are your go-tos for those that maybe have never tried Steve's products before?
Well, like I said before, the baba ganoush, which is essentially hummus, but we just switched the chickpeas for eggplant. It's really good. It's got a little bit of a weird texture to it, but I could just take a spoon and eat the whole thing of baba ganoush right out of the container. And then also we make tabbouleh, which is a very traditional Lebanese dish, or Mediterranean dish, I would say, but it's very simple: parsley, tomatoes, onions, and a little bit of spice, and it's just it's really good, and that's definitely my favorite salad that we have.
We're joined by Danny Chammas. He is the Director of Food Operations at Steve's Mediterranean. And Dan, your family's business is continuing to boom. It's continuing to have a lot of success. And it's not necessarily the case for a lot of other businesses that are in your industry, that are in the food business, that are in the restaurant business. So from your perspective, what would you say is the key difference just the key to the operations of Steve's Mediterranean that really sets your company apart, and it has created a situation where you can sustain the success that you've had even through a crisis like we're in right now?
Yeah. So I think it's the quality of the food. I think we make a very high quality all across the board, from our salads to our dips, and we have a large variety. I haven't really talked too much about the meat product that we offer, but we do meat pies, beef and chicken kefta or kebabs, because those are kind of interchangeable, those names. We do chicken tawuk too, and we spend a lot of money on the raw product, on the raw beef and the raw chicken. And we make sure that it's fresh, and we try and do as much as we can to keep our quality up. And I think the customers notice that. I think the customers appreciate how much we care about our product, and it shows through sales in all the stores that we're in. And yeah.
We're joined by Danny Chammas, the Director of Food Operations at Steve's Mediterranean, with us today on the Megacast. Learn more about Steve's Mediterranean and all of their products on their website at stevesmediterranean.com, and you can find them in a number of stores here in southeastern Michigan and Metro Detroit, such as Kroger, Meijer, Johnny Pomodoro's, Nino Salvaggio, and more. Danny, thank you for being with us today. I appreciate your time.
Oh yeah, thank you so much for having me.
Pleasure having you on. stevesmediterranean.com to learn more about Steve's Mediterranean and all of their products, and find where you can get it at your local stores to support a local Michigan business creating food right here in our local area. And they also have some job openings. So if you're looking for work and you want to work for a family business and a mom and pop owned business here in southeastern Michigan, go ahead and find more information on them at stevesmediterranean.com. We're going to take a quick break, and on the other side of the break, okay, we've talked about the food angle. Now we got to talk about the restaurant angle and how COVID-19 is currently affecting our restaurants and our hotels in the local area and across the state of Michigan. We'll be joined on the other side of the break by John McNamara. He is the Vice President of Government Affairs at the Michigan Restaurant and Lodging Association. That coming up next. You're watching and listening to the Megacast.
You see certain things get reincarnated in your children. My daughter is very much inspired by my wife's artistic pursuits. So my daughter started making necklaces. She makes what we call affirmation fashion. I tell her every day that your black is beautiful. Your black is beautiful. Your black is beautiful. And if there's anything better than being beautiful, it's being smart. And if there's anything better than being smart, it's being kind. And reaffirming that every day is our method of making sure her chin never drops. My dad wasn't around, and I remember riding a bike and falling off and cutting myself, and me never just wanted to get back on it. People ask, how your children learn how to ride a bike, and you didn't. I didn't teach them. I just created an environment where they taught themselves, and all I had to do was be there.
Who is struggling right now?
I am.
My son is.
Many are struggling with anxiety, depression, and substance use. Before it becomes a crisis, reach out to MyCal, the Michigan Crisis and Access Line for free confidential support 24/7. Available in the Upper Peninsula and Oakland County. Just call or text 1-844-44-MyCal or chat online at michigan.gov/MyCal. A message from the Michigan Department of Health and Human Services.
As we continue to go through the COVID-19 pandemic and play the balancing game of keeping the community safe with also moving life forward and trying to save businesses, trying to save people's livelihoods, especially in industries that have been hard hit by the effects of COVID-19 beyond just the virus itself. And to talk more about that issue on the front of hotels and on restaurants, we're pleased to be joined once again by the Vice President of Government Affairs at the Michigan Restaurant and Lodging Association, John McNamara, with us on the Megacast. John, thanks for being back with us.
Thanks for having me. Hope everyone's having a good Monday so far.
Yeah, you as well. So at this present time, restaurants are still open at full capacity. It's been that way for well over a month now, almost 2 months now, as we're approaching the month of September after that July 1st full reopening. What is the status of those restaurants? Are we starting to see a comeback of sorts in their numbers and their bottom line, or are they kind of still in the same place they were really at the beginning of July?
No, we're starting to see a comeback there. I mean, their largest challenge right now, one would be, consistent staff. Second would be the supply chain is still very, very backlogged, and that's causing prices. And then third is just sort of this, misnomer that this industry is 100% back to where it was in a pre-COVID world, and that's just simply not true.
So it's not back 100%. It has the ability to operate at regular capacity, but that's just capacity. That's just people inside the doors. So right now, for most of these restaurants, whether they are the small mom and pop restaurants or they're the chain franchises, what does 100% in this current moment look like for the majority of these restaurants?
100% looks like you're running a limited menu, but most importantly, you're running a very limited staff program. I mean, the odds that the person who served you, brunch yesterday was working a double, probably worked a double Saturday, and is probably working a double today. So they are incredibly thin on staff. A lot of them have a very, very dedicated team who want to be there and are doing their best to be there. But, you can only push people so far to whereas you're going to burn them out. So we're still seeing a lot of places who will choose to close a day or two, have limited hours, have limited menus, and are still trying to just do the best they can in what is still a very uncertain world right now.
I mentioned a little bit coming out of the break. I talked a bit about finding that balance and maintaining that balance. And I feel like that's something that's got to be very important for these restaurants right now on the staffing front, because while you need to keep up with the business that's coming in, with the increased amount of people that can come into your doors each and every day and deal with the situations on the front lines, knowing that you're already short-staffed, you got to kind of have that balance there where you're providing the service that you need to provide for your customers to keep them coming back through the doors, but also not overworking your employees to the point where they are leaving the job because it's so hard to fill those positions. How are these businesses, especially the mom and pops that don't have necessarily don't have the name recognition and that kind of support, which is really all they get in that support from the big chains, how are they managing that while also balancing the need to keep their bottom line strong?
It's hard, and we're heading into college football season and kids coming back to school, and that's just going to put more people in these areas. Now, the mom and pops in general have a more loyal customer base and sort of a bit of understanding. You're seeing the bigger chains. For example, Buffalo Wild Wings, I was in one on Friday last week, and they're going to start making it so if you download the app, you can check out on your phone, right? And when you're done, and you can check out and go. I think you're going to see more options like that where technology is going to help relieve this burden. But eventually, hopefully, staffing will get somewhat back to where it was pre-COVID. But also the supply chain will catch up down the line, and you won't have a massive shortage on chicken wings, and you won't have beef prices be sky high. In fact, right now it's cheaper to buy beef it's cheaper to buy beef. Sorry, more expensive to buy beef than it is lobster.
Wow,
lobster's cheap right now.
Wow, and in terms of that. Because there is so much need across the board for restaurants, not just in Michigan, but across the U.S., and issues in the supply chain in one area of the U.S. affect the supply chain in the other area of the U.S., regardless of what is the regular livestock of the time in Michigan or in Nebraska or in Texas or anywhere else. So in that sense, as you have these mom and pops, these smaller businesses that are family run, that have really for years had to keep money tight to run a business that can support their family, versus these larger chains that tend to have their systems in place. Right now, with the supply chain issues that are in place, is that competition having a greater effect on those smaller mom and pop kind of restaurant businesses than the larger chains, or is it kind of more of an egalitarian issue?
No, it's impacting the smaller independent operators more, simply because a lot of these places it's by volume. We've seen a couple different places around, Lansing, East Lansing, where I live, who have just taken, I keep going back to chicken wings, but this is the prime example right now of disruption in the market, who have simply taken chicken wings off their menu for the time being. You've seen Wing Zone has, pivoted to Wing and Thigh Zone. You're starting to see more chicken thighs on menus in a lot more places, because those are more readily available than wings. So it's impacting the smaller ones more, but that doesn't mean that, Buffalo Wild Wings is not hurting just as bad. And in some ways more, because when you go to B-dubs, you're going for wings, most likely. So, and, we've heard cases of people running, B-dubs at times running out for, periods of time.
We're joined by John McNamara. He's the Vice President of Government Affairs with the Michigan Restaurant and Lodging Association, joining us today on the Megacast. And on that similar note, those staffing issues that we talked about earlier are also affecting across the board these small mom and pops and these franchises and these larger chains that have that name recognition. But a lot of these businesses in other industries, and including in the restaurant industry, as they're trying to attract staffers and trying to retain staff members as well, they're providing greater incentives and providing better hourly pay as well in some cases. Are you finding that these smaller mom and pops, similar to the supply chain issue, are having a greater issue retaining employees and keeping employees and attracting new employees versus these other chains, simply because there's less of a war chest of money necessarily, for lack of better terms, in place for them?
That's been decently egalitarian across the board. Okay. Of it's really tough to get. I mean, I had one board member who has 6 restaurants. He had 150 interviews scheduled and 6 people showed up. for the actual interview. I have members who are offering people $50 simply to fill out an application. So, maybe they can get that phone number and convince you to try to go to work. And I want to point out that the hotels are being hit just as hard on the staffing issue as the restaurants are. We just had our summer board meeting at Traverse City, and that staff did a great job, but everyone was wearing 4 or 5 hats. The person who checked me in was pouring wine at dinner and was cleaning rooms, and that was a senior management at the hotel. This was not someone who typically does one thing or the other. So it is all hands on deck across the industry, and you're seeing owners, managers, general managers, assistant managers who are bussing tables and pouring wine simply because that's what they have to do to try to get through this.
So let's talk more about the hotel side, because we always seem to focus on the restaurant side. That seems to be what captures the headlines, what captures the stories in the news media when related to this industry, or at least to what the coverage of your organization is. And at this time, you mentioned the staffing issues are definitely in place also at hotels. How has their overall management been affected beyond just the staffing, or including the staffing too, in our current times with COVID-19?
So yeah, a lot of the times you're seeing, if you're going to be there for 3 or 4 days, you're probably only, they're not cleaning rooms every day for sure. Now it's every other or maybe every 3rd day is when they're going in and cleaning rooms, simply because they don't have the staff to do it right now. They want to make sure people are checked in, are getting there. If you need more towels or you need something like that, they're happy to provide it. But someone coming in and changing the sheets and making the bed, in most cases, is not happening every single day. And that's simply just they don't have the person power to make it happen.
And is that affecting the ability for these hotels to have greater availability there for people to come in, especially as people continue to travel and we have big events going on in various places throughout the state of Michigan?
No, it's absolutely making it harder, and it's just making it harder because you have a pent-up demand for travel, largely due to in 2020 there was very little bit available, and everyone wants to get out and everyone wants to travel this year, but there's just sometimes not the staff to make it happen. Especially in northern Michigan is being especially hard hit by this as well. In the best of times, staffing in northern Michigan is hard to do, and these past 2 years have been even harder up north. So my hats are off to everyone up north who's doing their best to make it work, and with a tourism season that part of the state desperately needs to make it through.
Yeah, our thoughts definitely with those businesses up in the UP, especially where we saw in the recent census data that was released that in the last 10 years, many counties up in the UP and in northern Michigan and northern Lower Peninsula have had significant changes in population. It has not grown. It has definitely taken a dip, and that doesn't help in a time where it's already tough enough to find and retain staff. So on that note, John McNamara, Vice President of Government Affairs with the Michigan Restaurant and Lodging Association, what should people expect when they're going to hotels in this time? Because there is a short staffing situation. You mentioned that the rooms are probably not going to be cleaned out every day. It'll probably be every other day or every few days instead of every day. But how else is their experience being impacted by the current situation that these businesses are dealing with?
They're going to do their best to make your experience as best as possible. But with limited staff, there's only so much they can do. So, the gym will probably still be there, but it might not be staffed. The pool will still be there, but it might not be staffed. If it's busy, there may be a lifeguard. But it's just a group of people and group of very dedicated, hardworking people who are trying to kind of keep up with demand. And my ask is that hotel, restaurant, event, please just be patient with the staff that is there. They're tired. They're working really, really, really hard, and they're doing the best to give you the best experience possible. But it's, as I've said before, and I'll say it again on this show and many others, it's just going to take patience on everyone's part. And all I ask of you is be as patient as you can and understand they are doing the best that they can. But times are still tough in the industry.
We're joined by John McNamara. He is the Vice President of Government Affairs at the Michigan Restaurant and Lodging Association. And as we continue forward in this pandemic and we continue to have the recovery sort of hit a snag in some sorts because of the current situation that we're having. How are restaurants and even hotels at this moment in time, how are they adjusting to the current situation given the slight uptick that we've had and the moderate uptick now at this point in COVID-19 cases with the Delta variant in recent weeks?
So you're going to see a lot more staff are already wearing masks, and I think you're going to see going forward even more staff wearing masks. I think you're going to see some places posting signs strongly encouraging you to wear a mask while inside. It's not going to shock me if people are going to start asking for reservations or call ahead seating in some way, shape, or form. But I think you're just going to see them try to start to plan in advance a little bit more, just so they can be ready and they can provide service. So, if you're trying to go out with, 10, 12 people, I would call ahead and just let them know and make sure they can do it and accommodate that. But you're going to see them plan, prepare, maybe space some tables. But, pre-COVID, their goal was to serve you safely. During COVID, their goal was to serve you safely. And in a post-COVID world, their goal is going to be to serve you safely. That's what this industry does. It's what we've always done, and it's what we'll continue to do. We just are going to have to do it differently.
Yeah, frustration definitely is amounting, and impatience is definitely amounting as this pandemic does continue on and grow in its timeline. And we're seeing that in other places in the U.S. Of course, today, New York City is the first major city in the U.S. to require proof of vaccination in order to dine indoors. Are you expecting in the coming weeks and the coming months that we may see some restaurants and some parts of the industry that begin to put similar requirements in place? It's not going to happen necessarily at the state level or at major city level. We haven't had any indication of that as of late here in the state of Michigan. But given what's happening in other places, given that there seems to be less of an apprehension across the board to put these mandates in place, are you expecting that we may see, that customers may see some restaurants that begin to say, we need proof of vaccination for you to enter indoors?
I think so. There's already been one more nightclub setting in Detroit that requires proof of vaccination for that. You're starting to see at some shows and some concerts that you either have to have your vaccination or you have to take a rapid COVID test at the door to get in. So no, I think you will see some businesses who simply choose to say, we'd love to, we definitely want you to come in and have a good time, but in order to come in and enjoy yourself, we need to see a vaccination card. And that's every individual business's right as a business owner. If they choose to do that, that's their choice. I agree with you. I don't see it happening at the state level, like you've seen in other states. But I think you definitely will see, individual business choose to do it. And I think as you move into college football season, I think you'll see, I think that's probably where that uptick might start, is starting with college football season and some businesses saying, love to have you, got to show proof.
John McNamara with us on the Megacast, the Vice President of Government Affairs at the Michigan Restaurant and Lodging Association. Just another minute with you, John, before we'll say goodbye today. Anything else that would be important for our audience to know that you and your organization would like to say today?
No, we appreciate everyone, continuing to dine out, take out, whichever way you're doing it, and supporting the industry. And we ask that you keep doing it. But as I said earlier, it's please be patient. They're working really, really hard. And I look forward to a day when this is truly over. I think this is a bump that everyone was expecting, and it's a bump that we'll get through. But it's going to take just more creativity and more patience.
We've got through it before, and we'll get through it again. Thank you very much, John.
Thank you.
Parents do a lot of worrying. Get your kids caught up on childhood vaccines to protect them from these 14 preventable diseases, and you'll have 14 fewer things to worry about. Vaccines are safe and effective and save lives. So let's get caught up on vaccines and worry about something else. Get the facts at ivaccinate.org.
Welcome back to the Megacast. I'm Tyler Keefe. Man, it's been a great week here in our studios, Monday through Friday, live from 10 a.m. to 12 noon. You can find each of our episodes online on civiccentertv.com/Megacast. I'd like to thank all of you for joining us. Thank our guests today, Nicola Soares, Dr. Don Matthews, Callie Matteson, and Kirsten Abbott. Danny Chammas, as well as John McNamara for joining us, as well as our crew, our board operator and studio producer, Calvin Brown, booking producer, Larry Nyland, as well as our Zoom producer today, Ryan Younglove, Brendan back at Master Control, and all of the people that go into working here at the Megacast. We'll return with new episodes Monday, beginning at 10 a.m. until 12 noon live. Thank you for joining us. This has been the Megacast.